Waking up, gasping for air. Why? While waking up, gasping for air is not uncommon, it can be extremely frightening. Some causes, such as postnasal drip, are easily treated. Others may require medical attention and a long-term treatment plan. In this video, we describe why a person may wake up gasping for air and when to see a doctor. Causes. An individual may wake up gasping for air for a variety of reasons, including obstructive sleep apnea. Sleep apnea refers to involuntary pauses in breathing during sleep. The two main types are central sleep apnea, which is caused by signaling problems in the brain; obstructive sleep apnea, which occurs when a blockage in the airway stops airflow. According to the National Sleep Foundation, around 18 million adults in the United States have obstructive sleep apnea. A person may be unaware that they have the condition until someone informs them that they snore and gasp for air while asleep. When the person gasping catches their breath, they may not fully awaken. Additional symptoms of sleep apnea include morning headaches, daytime tiredness, memory problems, fatigue, irritability. Anxiety. Anxiety can lead to panic attacks, and when they occur at night, a person may wake up gasping for air. According to the Anxiety and Depression Association of America, around 70% of people with anxiety disorders report difficulty sleeping. Other symptoms of anxiety include restlessness, feelings of dread or worry, a fast heart rate, panic, difficulty concentrating. Asthma. Asthma is a chronic condition that causes inflammation in the airways. Nocturnal asthma is the medical term for having symptoms while sleeping. When the condition is poorly controlled, nocturnal asthma is common. Additional symptoms of asthma include coughing, wheezing, feeling unable to catch a breath, tiredness in the chest. Chronic obstructive pulmonary disease, or COPD. COPD occurs when small air sacs in the lungs are damaged. These sacs, called alveoli, become floppy, making it difficult to push air out of the lungs. Symptoms can occur while a person is sleeping. They may wake up gasping or feel as if they are suffocating. Other symptoms of COPD include wheezing, excess mucus, coughing, fatigue, tiredness in the chest. Heart failure. When the heart is not pumping blood as efficiently as it should, this is called heart failure. Abnormal heart valves, a history of a heart attack, and coronary artery disease can all lead to heart failure. Shortness of breath is one of the most common symptoms. At first, a person may only notice it during physical activity. As the condition progresses, a person may develop shortness of breath while resting or sleeping. A person with heart failure may also experience fatigue, swelling of the feet and legs, chest pain, abdominal swelling. Postnasal drip. Mucus and saliva produced throughout the day typically flow to the back of the nose and throat and are swallowed. A person may be unaware of this process. Postnasal drip occurs when this mucus accumulates and trickles down the back of the throat. As the mucus builds up, a person may feel like they cannot breathe. If they are asleep, they may wake up gasping for air. Gastric reflux disease, sinus infections, and allergies are all common causes of postnasal drip. Additional symptoms include bad breath, sore throat, a bad taste in the mouth, coughing. Diagnosis. A doctor will ask a person to talk about their symptoms and medical history. They may also perform a physical exam. The following test can help to determine why a person wakes up gasping. Blood test, a sleep study to determine whether the person has sleep apnea, an echocardiogram to check for heart abnormalities, an electrocardiogram to measure the heart rate and rhythm, a pulmonary function test to diagnose respiratory conditions. When to see a doctor. A person may not require treatment if they wake up gasping for air infrequently, show no other symptoms, and can get back to sleep quickly. However, if a person experiences this symptom often, or if other symptoms are present, they should speak with a doctor. If an individual who also has chest pain or cannot catch their breath, they should seek immediate medical care. Once the underlying causes are identified, a doctor will recommend treatment that can ensure uninterrupted sleep.